While studying at the university in Belarus, I realized that I was interested in scientific research. After graduation, I specialized in otolaryngology. I decided to change something in my life and choose Poland as the next place for my way. I like such advantages of Gdańsk as the international environment, many ambitious young people, a lot of interest in university scientists, and that Gdańsk is a really dynamically developing city. In a short time, I applied for doctoral studies and then continued my specialization in otolaryngology in the University Medical Center. After 4 years, I successfully defended my Ph.D. dissertation. I conduct, I think, a fascinating study analyzing the expression of pro- and anti-inflammatory interleukins in the pathologically changed tympanic membrane of patients with chronic otitis media with cholesteatoma using PCR and ELISA methods.
When he was ready with his Ph.D. thesis and he successfully finished his residency in otolaryngology, he joined our team both in a clinical part as a specialist in otolaryngology and also as a academic teacher and scientist in the Medical University of Gdańsk.
I find each of my projects really interesting. I began to work out several topics related to the diagnosis and treatment of ENT patients. For example, we are working on creating a neural network and using artificial intelligence in audiology with the Gdańsk University of Technology team. We are searching for biomarkers of salivary gland tumors, and we will try to develop a serious biosensor in collaboration with the University of Gdańsk team. We analyze the airflow through the nasal cavity and paranasal sinus using computational fluid dynamics methods of simulation in cooperation with Professor Tesh from the Gdańsk University of Technology. Fortunately, creating the Assembly of the Pharyngate Union of Universities in Gdańsk only foretells further development and new cooperation between universities.
He has a lot of ideas to develop new research. He is also very successful in looking for contacts with other universities.
Our scientific research regards both theoretical and clinical aspects of rhinology. Bilateral cooperation with Technical University of Gdańsk refers to nasal airflow and new technologies used in the treatment of chronic sinusitis.
Now we are preparing nasal stents to help people at the post-operative treatment after surgeries. Nasal stents requires patient-oriented approach. So basically for each patient we have to design a different stent because of nature of the nose. Basically each person has a bit different nose, a bit different size, so we have to design material implant to be able to fit it in our nose basically.
Septoplasty or nasal septum plastic surgery is the one of the most frequently performed otolaryngological surgeries in the world. There are several effective surgical techniques for this operation. Despite this, the cause of early postoperative period is often difficult for our patients. That is why we started to wonder how to improve the quality of life of this large group of our patients in the postoperative period and at the same time reduce the level of postoperative complications. Nasal splint is not our discovery, of course, and has been used worldwide for over 10 years. However, the idea of creating the drug-eluting nasal splint is original. Such a nasal splint could release painkillers, anti-inflammatory, antibacterial medicines, which could reduce the level of complication after surgery and accelerate the healing and regeneration of the patient's nose function after surgery. And as a result, it can improve the patient's quality of life. I hope that further cooperation with other universities will result in a number of inventions and we'll be able to put them into everyday use in the diagnosis and treatment of our patients.